Good evening and welcome to another edition of Nonye's Healthy Living Show. Today on Nonye's Healthy Living Show, we're going to be looking at family planning and contraception, choosing the right method. You know, family planning is a critical aspect of reproductive health that enables individuals and families to decide if, when, and how many children they want to have. Beyond that, it also plays a vital role in promoting maternal and child health, reducing unintended pregnancies, and ensuring that families are financially and emotionally prepared for parenthood. So today on the Yes Healthy Living Show, we've decided to spotlight family planning and contraceptives, choosing the right methods, and also knowing the different family planning methods that could also work for us as individuals and of course as families, because what works for one might not necessarily work for the other. So it's very important that you understand the particular family planning method that could actually work for you, and also take into account your medical history, family history in making the right decision to choose the right family planning method that could help you as a family. Joining the conversation today on Nonye's Healthy Living Show, we have Dr. Kenneth Nwokolo. Dr. Kenneth Nwokolo will be joining the conversation. He's going to be highlighting everything we need to know about family planning methods, risk, effects, and benefits. Dr. Nwokolo, welcome to Nonye's Healthy Living Show.
Thank you very much. I'm happy to be in this program to talk about family planning, choosing the right method.
All right, we're happy to have you as well. So we'd like to start a conversation with understanding what family planning and contraceptive actually is. Is it the same thing? Is family planning different from contraceptives, or are they just two sides of the same coin?
Well, they're not two sides of the same coin. They're kind of used interchangeably.
Oh, okay.
Because contraception is what leads to family planning. So without those contraception, you can't say you're planning for your family. So it's through contraception, which is a kind of, sometimes people call it family planning, sometimes people call it contraception. They're virtually the same thing. So they refer to the ability of an individual or couple to anticipate and then attend to the desired number of children they want, and then including the timing and spacing of those childbirths. It also involves using of those contraceptive, which could be drugs injected in the form of injection and others, to involuntary control fertility. That's all is as it concerns the family planning. So it has its own key benefits, which improve maternal and child health, economic stability, and then enhance quality of life. That's as a kind of introduction to family planning.
Okay, so what does one need to look out for when you're choosing a particular family planning method? Are there factors to consider when choosing a particular family planning method?
Yes, there is different factors to be considered when you want to choose a family planning. What works for this person does not what works for the other. There are different type of family planning depending on the need of the couple, because sometimes it's usually this couple's decision, though sometimes there's some condition that will give rise to individual decision, but usually the decision is what the couple does. So it depends on the need of the couple that will warrant the type of family planning they will choose.
Okay, so are family planning methods foolproof? Are there chances of failure, or everything is just set in stone? The one you use, it's definitely going to work. Are they all foolproof?
Yes, family planning, you can't say that family planning has a foolproof. All of them, all the family planning has different percentage of failures when it comes to use. So it is now when you weigh the different option according to the needs, you now know the type of family planning to choose. But there's other factors that also determine the type of family planning apart from the failure rate of those family plannings. Certain health conditions could also determine the right family planning to use.
All right, so can you say that, okay, what about unintended pregnancy or what's, because I don't believe anyone is unwanted, unintended pregnancy, can family planning methods also help?
Yeah, that is one of the importance of family planning, just like the name said, you have to plan. So the essence of family planning and contraceptive is just to prevent all those unintended pregnancies. You know, when we have unintended pregnancies, some people will now start thinking of what to do to those pregnancies. Some will start looking for termination of pregnancy, which is abortion.
Mm-hmm.
You know, in Nigeria, the law does not permit abortion.
Yes.
So some people will now want to do it in a hidden way, known as criminal abortion, which will result in a lot of complications. So because of those things, that's why the introduction of family planning and contraception, so that will prevent this unwanted pregnancy that will make people to commit criminal abortion, which eventually the complication may lead to deaths. So that's why we avoided all this by introducing family planning.
Now, some people might tell you, like some religion, they do not actually believe in family planning. Some might tell you that it's against their faith. Case in point, I know a man and a woman where I used to live before, they have 8 kids. And it's not like their standard of living is all that, like they're managing. You get what I'm saying? They're managing. They're not the Aliko Dangotes or the Otedolas. They're just managing to survive. And they're not looking for any particular gender. They have boys. They have girls. So when I was speaking to someone, I noticed the person now said that he has spoken to the man before. The man said that it's against their faiths. They don't believe in it. That it's not as if he wants to keep giving birth to kids all the time, but just that they do not actually believe in family planning. And what I'm asking is, where do we draw the line between religion and between what is actually supposed to be beneficial to families and even the society at large? Because giving birth to a certain number of kids that you know you cannot cater well for, at the end of the day, you leave them to keep coming out there to be constituting one thing or the other. Is that the right approach? Shouldn't there be a time or situation where we draw the line?
Yes, some religion against family planning. Let's just say, for instance, I know of Catholics are against family planning, but I go to church. I've not seen them, in quotes, preaching against family planning.
Mm-hmm.
So even though they're against family planning, I know there's some natural method apart from the different method of family planning we have. We have this natural method. You know, people have different understanding and perception of certain rules.
Yeah.
So they heard that their religion is against contraception. They are no longer asking questions. That means they should start giving birth as much as they can and be going, thereby causing nuisance to the society. Yes, I know that I haven't seen them openly campaigning against family planning, contraception in a Catholic church, but I know it's a kind of rule in a Catholic church that against the contraception, but I've not been seeing them. So in such a situation, it's now left for you. It's just that some people want to be more Catholics than the Pope. They are the people that will now carry the issue of contraception, saying our church doesn't want family planning. But in all sense, people who have had wide exposures have saw the reasons why they should use contraception, different method that suits them to prevent unintended pregnancy or having more than the intended number of children that they want to have. So many people have made use of their senses, based on their level of exposure and knowledge, to take their decision on which type of family planning. So it depends on the individual. Some people will want to carry it to the extreme, but I know that majority of the Catholics are using family planning. Does it mean those people who are using it will not make heaven or what? They're going to make heaven. It's a matter of choice. Some people making use of their senses while taking certain decision. So that's one thing I can say about that.
Okay, so do you think family planning is in any way beneficial to the society at large and to families
Yes.
beyond the religious,
Yeah, the family planning,
embargo placed
the,
on it?
the benefit of family planning cannot be overemphasized. The family planning has a lot of benefits. Take for instance, I want to have 2 children. These are the number I know I can control. With family planning, I can get those 2 children. You see somebody who is poor, uneducated, he doesn't even understand what is family planning. Even when you try to preach to those people about family planning, look at what you're going to do to control the number of children they have. Within them, they know they don't want this number of children, but you see them giving birth, it's just because of they don't have control. Maybe because they are not aware, lack of knowledge, or maybe because they don't know where to go to control the number of children they are having. So that's why we are still advocating for our awareness so that people will know. But some people know, so they are aware. They know where they can get those family planning, but just because of their local belief, some have been convinced that there is a lot of disadvantage while using family planning. So some of these factors are what will now make some people to have more children than they can train. And once they have more than they can train, the children start becoming nuisance to the society. You see them roaming about. They are not going to school because their father doesn't have their parent. They don't have money to train them in school. Before you know what will happen, they will start having some vices, joining bad cultism, armed robbery, chain smokers, and all those things, and consume nuisance to the society. So, but with the advent of family planning, you have the number of children you can train. They become very useful for you and then beneficial to the society.
Okay, all right, so let's look at different types of contraceptive methods. So in your own understanding, which could you say is the most safest and the most effective contraceptive method?
Well, most of them have a different, depending on the body system. Uh, Most of them works
The body
differently.
system of the person using,
Yes.
okay.
Because sometimes what works for this person may
Might
not
not
work
work
for
for the other person, okay.
So the one that works best for this person may not be the one that may work best for the other person.
Other person.
But in all of them, just like we have a barrier method, which involves the use of condoms. So there has its own advantage and disadvantage. We have a hormonal, which has under it we have a combined oral contraceptive, which are the tablets, the pills you take. We have progesterone only pills. We have injectable progesterone. We have subdermal implants. Even we have some hormonal IUCDs. So outside that, we have the IUCDs like copper T. Then we also have natural methods, which involve the use of monitoring your cycles and abstaining when your safe periods. So we also have a withdrawal method known as coitus interruptus. Those are different methods. We have even a surgical method in which situation you can do tubal ligation.
The way we get to tie your tubes?
Yes, you tie the tube and then you do vasectomy for male by tying the vas difference. So these are different methods of contraceptive, and then making choices depends on the needs. So there are some that are irreversible, like tubal ligation, vasectomy are irreversible. If you still have the intention of getting pregnant or having a child much later in life,
it's advised that you don't go for that particular
you don't go to those type of contraception. But for cases of IUCDs, sometimes it doesn't. IUCD like copper T doesn't have any hormone embedded on it. It just places it on the womb, and then it stays there and prevents pregnancy from taking place. Some of the hormonal contraceptives, some may have some side effects like some weight gain, and then kind of irregular menstruation like bleeding and all those stuff. So depending on the one that works for you better will determine your choice of contraception. Even health condition also
Can also determine
can
the
also
choice
determine
of
if you have some pre-existing health condition, they can also determine the type of contraceptive you use. So all these factors are the things that will determine the choice of contraception. So your provider of the family planning will help to counsel you. We have the WHO guideline on how to make choice of contraception.
Okay, the WHO guidelines, what does
Yes.
it say or how does that work?
Yes, WHO guideline is a kind of, let me just show you, it's a kind of what the WHO provides to help make choice of contraception.
Okay.
So they have column 1, 2, 3, and 4. With this, you can determine the choice of contraception. Let's take, for instance, we have a case of nulliparity is someone who have not given birth before. So what we are seeing there, 111, if you go to the column, you see use methods in any circumstances. That means somebody who have not given birth before can use all the contraception,
Okay.
depending on the choice.
Okay.
So on another hand, let's just go to someone who has a kind of vaginal bleeding. You see, if you look at the criteria there, he can use combined oral contraceptive, he can use progesterone only, but the copper T, levonorgestrel IUCD, implants, he cannot use. So with this guide, WHO guide, once you see a patient, you clock the patient, just take history, medical history of the patient. By the time you get the medical history of the patient, you'll be able to place the person on the appropriate contraceptive the person should use.
Okay, all right. So, how reliable is the coitus interruptus method? That should be the withdrawal method, right? How reliable is it?
Yeah, the coitus interruptus method, which is the withdrawal method, is not so reliable because sometimes when the tension is high, you won't know when you pour the whole stuff there, and then pregnancy will occur. So the chances, the percentage is the protection is around 60 to 75% protection for the coitus interruptus. So we have up to 20% failure. So it's not always the best method to use when it concerns the contraception. But things like IUCDs is up to 99% protection. We can always advocate for those ones that have up to 99% protection.
Okay. What about hormonal contraceptives? Do they cause any long-term side effects?
Yeah, hormonal contraceptive, you know, most of them are short-acting. Most of the highest hormonal contraceptive should be lasting around that kind of 5 years or thereabouts. So there's more monthly pills. There is 2 monthly or 3 monthly injectables, depending on the choice. There is 3 years. There is 5 years. So sometimes they causes some hormonal changes, and then some occasional, when the person wants to see the period, he may see it more than the number of days he's supposed to see it. But in such a case, we always have a remedy for that. So those are the.
What's the remedy?
When it's being removed, sometimes there may be a little bit of delay in conception. Aside that, there's no serious major side effect of most of those contraception.
Okay, what about birth control pills? Can they cause infertility?
No, birth control pills, as soon as you stop, it cannot cause infertility. As soon as you stop, it reverses itself, the fertility.
So the drugs do not have any effect on the reproductive system?
No, it doesn't. The only thing is during those periods that you want to make use of them, that is when they act. As soon as you stop, 2 to 3 months, everything about the facility will return.
Okay, but there are reported cases of women that have said that they used one family planning method or the other, but definitely not natural family planning method. Definitely a medical family planning method or the other. And when they were ready to start giving birth, they were finding it difficult to conceive. Some even, like there is one that trended a while that even the BBC interviewed, because you know a lot of people do surrogacy, but I think people are still keeping it on the hush hush. I don't know. I think for their own personal reasons. I don't know, because maybe they feel it's not something to be, announced, or they pretend or something. But this woman, I believe she's not the first person. The only difference is that she was very vocal and she put her own out there. You understand? So she was saying that when she got married, she gave birth to the first child. Before a year, she took in again. Like when she was still nursing the first, she took in again. She gave birth to the second one. While she was still nursing the second one, she got pregnant, and this time around twins. Unfortunately, she miscarried. So after the miscarriage, she felt like, since it's not very hard for her to get pregnant, it's better she does something so she could at least take care of these two toddlers before trying again. So she went for implants. IUD, I believe. She went for implants. Then she said when she was ready to give birth, when she moved the implants, she couldn't get pregnant. She tried, she couldn't get pregnant naturally. So she started opting for IVF. She had about 4 cycles of IVF, and they all failed. That was when she now started thinking about surrogacy. And she now decided to get a surrogate who now later gave birth for them and all that. So I'm saying, this medical family planning method, don't they have any lasting effects based on this lady's story?
Well, what I can say about this is the woman used IUCD, cooperative IUCDs, probably as part of the contraception. From the documented history and evidence, IUCDs are one of the fastest, especially cooperative. Immediately you remove, contraception returns almost immediately. So in her case, it's an exception. Probably there may be some factors. Probably when she had the IUCD, he must have developed an infection during the period. So those infections must have ascended, maybe causing a kind of maybe tuber blockage or any of those things, which made the conception difficult for her. Probably under normal circumstances, IUCDs like she did does not cause infertility. Rather, it's one of the known fastest reversible contraception that we have, because it doesn't have hormones that are embedded in it, which we may say probably may have caused maybe 1 or 2 hormonal imbalance. No, it's one of the fastest reversible hormonal, non-hormonal contraception. So probably there may have been other factors that may have prevented her from getting pregnant. So, but because she has used the family planning, the coincidence now, every blame now went to the family planning. So probably that's what I can say about that.
Okay, so what about teenagers? Is it advisable for teenagers to be placed on contraceptives?
Yes, it's very advisable for teenagers to be placed on contraceptives. In fact, we have had some cases that arose whereby they saw a mother who brought her child, a teenage child, and then be requesting that contraception be given to the child. Then when the child was cancelled for and she was cancelled, why do you want to give this child contraception? She said that the way he's seen the lady, the child and the man is no longer comfortable, and that is why he's requesting. And then when the child was asked, the teenager consented for the family planning. He should be given family planning. Otherwise, our target is to prevent pregnancy. When you find that you're given the adequate orientation, avoid this, avoid that, avoid that. You know, during those teenage period, the urge and the pressure is so much. So for when you find out that somebody can no longer control those urges, rather than getting unwanted pregnancy, the person should be given contraception. So to avoid unwanted, because sometimes when they get this pregnant, where they will go to get, because sometimes because of what the law said about the abortion, most doctors don't even want to get it. It is when you get pregnant that you know that to do abortion is a very difficult thing in this country. Otherwise, the only people who venture into abortion are the quacks. So probably in the process of doing that, they can cause damage, which will prevent the person from getting pregnant in future.
Okay.
They can also cause death, because environment where they eventually get those abortions is not a healthy environment. On the process, they develop sepsis or excessive bleeding, and eventually will lead to the loss of their life. So rather than allow all these circumstances to take place, it is better you give the child contraception.
Do you think in this part of the world, people are, very open-minded about family planning and contraception? Do you think we're very open-minded about that? I'm just imagining when I was a teenager, my mom taking me to the hospital to say that I should be placed on contraceptive. I'm just, thinking of how that conversation was going to play out. Do you think we're open-minded enough to embrace family planning methods and contraceptives and accepting that this could actually reduce the incidence of teenage pregnancies, unintended pregnancies, abortion that are done in the wrong way, that people might end up losing their lives or even losing their womb in the process? Are we really open-minded about these conversations with regards to contraceptives?
In terms of contraceptive, we have not gotten to the stage of being too open-minded about them. Everyone is still doing it. Just like maybe one person may just hear us now talking about contraception and saying that you can give a teenager contraception, be saying to Fiakwa, how can you give a little child? Are you encouraging her or those kind of things? But sometimes it is good we face the realities of life. You find that this person is highly promiscuous. Self-control is difficult. So why allowing the person to run into trouble? So you are giving the sex education and it's not working. So the only option you have is to counsel the person for contraception. If the person agrees, contraception is not what you force on people.
Okay.
You give adequate counseling, counsel the person. If eventually the person agrees to take those contraception, it should be given to prevent all those teenage pregnancy and unwanted pregnancy. And not seeing it from the religious point of view or being holier than thou. Hey, it's a bad thing to give a contraception to a teenager. No. If you look at the angle the teenager is going, instead of running into trouble, give the child contraception and then save the child from unnecessary stress.
Okay. All right. This is still Nonye's Healthy Living Show, and we're talking about family planning and contraception, choosing the right method, and also talking about knowing your medical history and deciding the particular method that actually going to work for you. Okay. And some people will ask if there are common side effects of hormonal contraceptives. Are there side effects to using hormonal contraceptives?
Yes, there's the practical common side effects we have been encountered is that there are some that will give the contraception, their body system will not be so much at home with it. You see them bleeding longer than normal. It will happen the first month, second month, third month, and then continues a lot of irregularities. Those people, it means that the contraception is not good for them. So you think of alternative contraception. There are some people that will have some bit of weight gain. Not as they blame it on contraception. Some people will have a lot of weight gain or gain a lot of weight and then blame it all on contraception. It's not true. Yes, there's some couple of weight gain with contraception, but majority of them comes from once you have the family planning, there is this kind of sense of protection and peace of mind that we'll have. Not every month, maybe you might have met with your husband every month. You're thinking, am I going to see my menses? And before you think, and then any delay from the menses, you must have lost 2 kg, thinking maybe you have gotten pregnant again. So all those stress are no longer there. And then nothing is bothering you again. You are sure because you're on family planning. You're already protected, so you have peace of mind. Those things will help to add to those weight gain. Outside that, there are so many people that eat a lot of things, junks and all those things. They will be gaining weight. I've seen so many people who did not use contraception, but they are gaining weight more than people who are using contraception. But what betide that he used contraception, he will blame it all. It is this family planning that I just put this day. That is what is making me gain all this weight. But it's not true. There are so many people who are not using contraception, but they have gained double of their weight. But if by peradventure there is for contraception,
do not blame it on the contraception.
All the blame will now be on those contraception.
Does this contraception, does it affect your menstrual cycle in any way?
Yeah, sometimes it may affect the menstrual cycle.
In what ways?
Like there are some that will not see the menstrual cycle maybe a month or two. The next month they will see it. There is no problem about that, because some people will think those, because the blood did not come out, all of them are there in their body disturbing. No. It's just that the cycle was prolonged, maybe 1 or 2 hormonal changes. So those are some intermittent changes in the menstrual cycle. Or you see the people, they bleed a little bit longer than they should, and then it will stop again. Those are some changes they will notice.
Okay, I'm going to be asking you some common questions that people always ask when it comes to the issue of family planning and contraceptives. All right, so the first one is, can I get pregnant immediately after stopping contraception?
Sure, you can get pregnant immediately after. In fact, there are some people that will remove the contraceptive this month. The next month, they will get pregnant.
Okay, so is tubal ligation 100% effective?
I can't say it's 100%, but I think it is 99 points. Something percent effective.
Almost.
Almost, yes.
Can a vasectomy be reversed if I change my mind?
No, vasectomy can never be reversed if once you change your mind. It's a permanent contraception.
Okay, so what is the best method for couples who do not want children in the future?
The best method for people who does not want children in future, vasectomy is fine, but men will not agree to do vasectomy.
Why is that?
And then so many of them say, they will say no.
But does it affect their sexual activity?
It doesn't affect their sexual activity actually. They will not agree, no matter how you try to do it. Only, in fact, since I've started practicing giving contraception, I have never seen a man who accepted to do vasectomy.
Okay, so can a woman track her fertility for natural family planning?
Yes, a woman can track her fertility for natural family planning.
Okay, all right, so let's come back to the discussion. Now, I want to talk about STIs, sexually transmitted infections, and contraceptions. So some persons will ask, can contraceptives prevent me from contracting sexually transmitted infections, STIs?
Well, the contraception, apart from the barrier method, which involve the use of male and female condom, they are the one that protect against STI. All other contraception does not protect against STIs. Okay. So contraception that protects is only barrier method, which is condom, male and female. So all other ones does not protect against STI.
Okay, so some persons will still ask, why is it important to use condoms if a contraceptive method is already in place?
Yes, because of we are trying to. There's a lot of infection. We have HIV infection, we have hepatitis infection, and then several other numerous sexually transmitted infection. So the reason why we are using condom in addition to someone who are already having a contraception is to protect against STIs. So because the contraceptive pills or devices they are using does not protect against STIs.
So can birth control pills increase the risk of infections in any way?
Increase the risk of
infections, yeah, birth control pills.
No, the birth control pill does not increase the risk of infections.
Okay, so somebody wants to know that are there any record of any contraceptives that can actually offer dual protection, prevention of pregnancy, and protecting one from STIs?
Yes, there is a contraception that can give a dual protection.
Okay.
Just like we made mention earlier. The barrier method, which is the use of condom, both male and female condom, can protect against STI and also act as a contraception.
Okay, so let's talk about the morning after pill, emergency contraception. Tell us about the morning after pill. How does it work? How effective? Are there side risks to the morning after pills?
Yes, emergency contraceptions
yeah.
are there. In fact, we have two of them. The progesterone only pills and then the copper T IUCDs, the emergency contraceptives. So they offer protection like for copper T, it can offer protection up to 5 days after ovulation. It can give you protection. But anything after that, the protection is not guaranteed. So for progesterone only pills, it can also offer protection. The protection depends on when you took it. Immediately after sexual protection, within 24 hours, it's almost 99 to 100% protection. After 24 hours, the protection reduces. After 48 hours, up to 72 hours. But as it goes, that's how the protection reduces.
What about, are there side effects to the use of emergency contraception?
The only use of emergency contraception like progesterone, the only thing is that it can bring your menstruation forward a little bit or delay it a little bit.
In terms of fertility, I mean?
In terms of fertility, it doesn't have any problem. Yes.
It doesn't?
Yes.
Okay, interesting. All right, so I'm going to be, talking about some statements, the things people say. Okay. So you're going to be telling me if it's actually true or false. Okay. First is contraceptives are just for women.
No, contraceptives are not just for women.
Family planning is only for married people.
No, family planning is not only for married people.
Why is it not for? It's not children we're talking about. Children are children what I talk about.
Yes, it's not only for married people. Like what is obtainable in our society, you see unmarried people cohabiting together. They don't want pregnancy. You see young women who are of puberty, who out of curiosity want to experiment, have sex, peer pressures, under so many influences want to have sex. So there need to be aware of so many protection contraception in order to prevent those unwanted pregnancy.
Okay. All right, so birth control pills causes birth defects.
Not at all. Birth control pill does not cause any birth defect at all. So all those things are false assumptions.
Really? It doesn't?
It doesn't.
Okay, birth control pills causes cancer.
No, it doesn't cause cancer. It doesn't cause cancer.
All right, this one is based on morality. Family planning causes promiscuity. Because you feel that you know if you get pregnant, or you know if you get infection, it is not just an excuse to just do as you like.
Well,
it's not
actually true.
Okay.
They get. It's a kind of being extra careful. Indirectly, depending on one perception, there are some people, when you drop a statement, we look at the generality of those statements. There is an exception to it. There are some people who want to use the family planning in order to achieve their or maintain their promiscuity. It's true. There are some people that will do it to achieve that, but generally, some people are using it as a kind of protection to prevent unwanted pregnancy. So that is the sole aim of it. Even though I'm much aware that there are some people that will use it to satisfy their promiscuity.
Okay, so natural family planning methods are not effective.
No, you can't say that natural family planning methods are not effective. In fact, there are many families today who have been using natural family planning, like monitoring their cycle and knowing when they are on danger period, that is their fertile period, and avoiding sexual intercourse during those periods. There are some that are very good at doing withdrawal methods. So they are very good at doing that. They have been using it without using family planning to achieve. If you look at the percentage of people who are even using the natural method to the people who are using the maybe pills or IUCDs, you find that we still have a greater number of people who are using natural method than the artificial method of contraception, and yet they are not getting pregnant. But ideally, the avoidance of had I know or doubts, it's better to use contraception.
IUDs can move to other parts of the body from where they were originally implanted.
No, there's no way IUCDs can move to other part of the body. There are some people that they say that the IUCDs they inserted disappeared. No, they say that it has moved to different part of the body, and they will be looking for it too. This is that sometimes the IUCDs, when you put them, even taking your bath and washing your body, mistakenly you can pull the IUCD without you knowing. Probably you're bathing and then you don't know you have thrown away your IUCD, because when you search it, it has a rope that is left to be inside the vagina, very short one. So probably on the process of washing your body.
So the rope doesn't enter the body, the rope is outside?
The IUCD will enter inside the womb.
Yeah.
And then leaving the tiny rope which is act as a probe for easy removal when the time comes. So that when you want to remove,
you just pull it out.
So that is it. So they will throw away their IUCDs. When it is time for removal, they will start looking for it. Sometimes ask them to go for scan. When they go for scan, they will not see the IUCD. They will just continue to insist that it
has moved to somewhere. All right. Okay, so long-term use of contraceptives can actually cause health problems.
No. Well, like most of the contraceptives are short-term. I have 3 years, 5 years. It's only IUCDs that is up to 11 years.
Well, that okay. So there are no chances that it could cause any health hazard.
No.
Okay, so contraceptives can accumulate the body.
No, they cannot accumulate. There's no way they can accumulate in the body, because it's just those hormones that will be releasing small. As soon as you remove them, that's end. Or when they expire, they will just remove them.
Family planning is against religious beliefs.
Well, for some religions, it's against their religion, but for majority, it's not against their religion.
Sorry about that. Family planning can cause or can harm future pregnancies.
No, except in rare cases. In rare cases, which are very few, it will delay a little bit, but cannot stop future pregnancies.
Okay. This is still Nonye's Healthy Living Show, family planning and contraception, choosing the right method. We'll go on a short break, and when we return, we're going to be rounding up. I will be speaking with Dr. Kenneth Wokolo. He has been educating us on different facets of family planning and contraception. We'll be right back. welcome back. It's still Nonye's Healthy Living Show, showing here on Annabelle Forced family planning and the contraception, choosing the right method. I hope you're watching. And some of the misconceptions people have, like saying that family planning causes infertility. This is one of the major things people say, and this is why people are always skeptical about embracing family planning method, because they're worried it's going to affect their reproductive health in the future. But based on the experts in the studio here, what he has been talking about since we started the program, he's saying that science has not proven that family planning causes infertility. That once you remove the family planning method you're using, then you can go ahead and get pregnant. So you see, that is actually a misconception. That is why it's very important that you seek information from the right source. All right, we're still moving on. So another one is that older women do not need family planning.
Yes, yes, older women, most of them
Older women.
Most of the older women who have gotten to their menopause do not need family planning.
So women can conceive once they get to menopause?
Yes, as soon as women get to menopause, the conception is gone. So in such a situation, what are we looking at again? We are trying to prevent pregnancy from occurring, since the nature have taken its course. So there's no point giving them family planning again.
Family planning is only for women who have had children?
No, it's not only for women who have had children. It's for people who doesn't want unplanned pregnancy. That's for them. Or who doesn't want unplanned family planning is for them.
Emergency contraception like the morning after pill can actually cause abortion?
No, no. It doesn't cause abortion. They are just contraception. They prevent the pregnancy not to take place. If the pregnancy have taken place, they can't do anything to those pregnancy anymore. So they don't cause abortion.
All right, so you mentioned vasectomy is a type of family planning method, right?
Yes, it's a type of family
planning. All right, so
method.
Vasectomy, men who get vasectomy lose their manhood.
Would they?
Men who get vasectomy lose their manhood.
No, they don't lose their manhood. The manhood is completely intact. It's just that they cannot get a woman pregnant again.
But it doesn't affect their...
It doesn't affect.
Okay. Withdrawal and reading method are the most reliable forms of contraceptives.
No, withdrawal is not it's the least reliable method.
It's the least
reliable method, yes.
Okay, interesting. All right, so in all these different contraceptive methods and misconceptions and myths and information and whatnot about family planning and contraception, for you as a medical doctor, what do you think? You know, the topic is family planning and contraception, choosing the right method. First, how can families choose the right method? What should they be looking out for when choosing the right contraceptive method?
Yes, what they will be looking at, want to make choice of contraception. One, for how long would I want to
do the family
planning?
Okay.
It will help. What type of family planning will I be comfortable with?
Okay.
Then, is there any health condition that will affect this family planning? So all these factors are factors that should be put in place before family planning. So when you want to go for family planning, you meet your family planning experts, because some of them have been trained on some of these factors on choosing the right family planning. Once you come, they check your medical history, ask you 1 or 2 questions. Do you have this health condition? Do you have that? Do you have that? And then when they have ascertained all this, they should be able to help you to make choice of family planning.
Okay. What's your advice to people who are still skeptical about adopting family planning as a method to manage their family?
Well, for people who are still skeptical about using family planning, I can tell you that so many people are using family planning and they don't make noise about it. The people who are making noise about family planning are the people who have never even tested family planning. They are the people who go about convincing, if you see the energy they use in convincing others not to use family planning. But a lot of people who use family planning will quietly use their family planning. You won't even know. They'll be going about their business. So my advice for people, if you know that the natural method you cannot do it, I would advise you to go for family planning. It will be the best decision for you so that you'll be able to plan your family. It will not disrupt for people who are young, who are going to school. It will not disrupt your education. You will know when to conceive and when not to conceive. In fact, family planning, the benefit of family planning cannot be quantified.
Yeah.
So I advise people, go for family planning. There are different methods. If this one didn't work for you, the other will work for you. So family planning is the best thing you can make use of in order to achieve the desired family you want.
Okay, all right. So family planning empowers individuals and families to make the right decision about their reproductive health. So choosing the right family planning method that will work for you depends on personal health, lifestyle choices, and a whole lot of other factors. But what you need to know is contraception is not just about preventing pregnancy. It's also about ensuring that your reproductive health is intact and also preventing and any STIs and improving your overall and general well-being. Well, you know, a lot of misconceptions that abound, like infertility is always one of the major reasons why people run away from embracing family planning. But based on what Dr. Nwokolo has stated here today, he has said it's important you speak with your healthcare provider to determine the right family planning method that will work for you, depending on your medical history and also your lifestyle, right?
Yes.
Determine the one that will work for you. But he has also said that once you get rid of the family planning or contraceptive method you're using, that's once you want to start getting pregnant, there is nothing stopping you from getting pregnant once you've gotten out the family planning method or IUDs or whatever you implanted. So this issue of infertility should no longer be something that hold people back. You know, so choose the right method that works for you. But while doing that, ensure that you speak to your doctor so you could work together and determine what is actually going to work best for you. We'd like to thank Dr. Kenneth Nwokolo for taking our time to come to Nonye's Healthy Living Studios today to educate us on family planning and contraception and the importance of choosing the right method that will work for you. Thank you, Dr. Nwokolo. Hope to see you some other time.
Yeah, thank you, Dr. Preska. It's a wonderful time this evening with you.
Indeed,
thank you very much.
It was. And all those misconceptions you managed to clear it.
Yes,
and
yes.
all those men that don't want to do vasectomy.
We try to be convincing our men to go and do vasectomy because once they do vasectomy, case closed.
You know, the reason what I worried is because of the fact that it might affect their...
No, it will not affect them. I'm encouraging you today to go for vasectomy.
So you don't hear...
And save your family from every other stress.
Sure, I don't hear them. So, men, if vasectomy is something that is in the cards or is an option for family planning for you, well, it doesn't affect your manhood in any way. So, go ahead, support your family, do what needs to be done. At the end of the day, it's the family that matters, and whatever works for the family should be your priority. Well, we'll hope to see you at the stadium tomorrow. You know, tomorrow is another day to stay fit and stay healthy, because healthy living is possible with Nonye Soludo. Well, till next week or Nonye's Healthy Living Show, I am Priska Wonko. I'll see you.